As an 18-year-old young adult, I like Obamacare because I get to stay on my parents' health insurance until I'm the age of 26.
I don't particularly like Obamacare because it has caused the price of my health insurance to increase.
From what I've heard about Obamacare, I really don't have a problem with it because I don't have to worry about paying any of my health insurance until after I graduate college.
I am against Obamacare because as a small business owner, when Obamacare took place, went into effect, our premiums went for our family, they tripled. They went from $500 a month to $1,500 a month, and the deductible doubled. So it's supposed to be affordable health care. It is not affordable for us.
I like Obamacare because I'm 21 years old and it has allowed me to stay on my parents' health insurance plan.
Obamacare has done many good things for the healthcare system of the United States. It has slowed the rate of increasing healthcare costs and provided millions of people with proper health insurance. It has kept insurance companies from being able to deny coverage to those with pre-existing health conditions, the ones who need health insurance the most. Businesses with more than 50 employees under the regulations of Obamacare are required to provide their workers and their workers' families with health insurance. And last but not least, Obamacare allows children to be on their parents' healthcare plan until they reach age 26. This is great for college students like myself who really aren't in the position to be on our own healthcare plan. These are just a few of the benefits that Obamacare has had on our healthcare system. But as you can see, Obamacare has offered coverage and security for millions of people who would otherwise not have it. One of the main goals of Obamacare is to ensure that every American has the proper health insurance. How do they try to accomplish this? They penalize and tax people who decide they don't want to pay for health insurance. But wait a minute, if they're having to penalize people for not having health insurance, that means that not every American is covered and that Obamacare has failed in this area. Obamacare is also a failure in the eyes of doctors and other medical professionals. Pharmaceutical companies suffer from the rising cost of drugs due to Obamacare. Doctors suffer due to the loads of paperwork and rise in responsibilities. This has created a wedge in between doctors and patients, and that doctor-patient relationship is vital to our healthcare system. Obamacare represents a socialistic system where many Americans, especially in the middle class, are forced to pay higher insurance premiums, not because they need it more, but to compensate for the low income and unhealthy lifestyle of others. Obamacare was created as an effort to solve three of America's healthcare problems. 1. A large number of uninsured people. 2. The denial of coverage by insurance companies to people with expensive pre-existing conditions. And 3. A high cost of healthcare. First of all, Obamacare obviously has not resulted in coverage for all Americans. There are still over 4 million people not insured because they are opting to pay the penalty price. Only in an ideal world would everyone have health insurance. But I believe that the way to make sure as many people are covered as possible is not to penalize people who aren't covered, but to create a plan that appeals to as many people as possible. My alternative to Obamacare would be outlined by the following principles. Number 1, it will be simple and explainable to all Americans. Number 2, it will address the three issues of lowering costs, dealing with pre-existing conditions, and increasing the number of people who are insured. Number 3, it will keep the benefits of Obamacare, like covering those with pre-existing conditions and those under the age of 26. Number 4, it will end the mandate to purchase health insurance. Because let's face it, the solution to the problem of not everyone being insured is not to force people to buy insurance. And number 5, it will restore the idea that people are accountable for their own actions.
This could be done by allowing surcharges on things like smoking.
Under my healthcare plan, the only people who pay for medical expenses that are a direct result from unhealthy decisions are the ones who make those decisions. Basically, my alternative to Obamacare will strive to meet the needs of all Americans without penalizing people who do not deserve to be penalized.